Hello. Welcome everybody to Revive Health's daily briefing live for Friday, March 20th. This is our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators dealing with the COVID-19 crisis. I am Chris Bevelo, Health Systems Practice Lead at Revive Health, and your host for the show. I am joined, as always, by Chase Kleckner, Senior Marketing Manager at Revive Health, and our show's producer. Hey, Chase.
Hey, Chris. Glad to be here.
And we're very fortunate to have with us today Sylvia Manrique, who is SVP Client Experience at Access, which is a multicultural agency and our sister agency. Sylvia is a multicultural marketing expert with 20 years of experience helping brands connect with the country's 60 million Hispanics. Hi, Sylvia.
Hey there. How are you?
Thanks so much for joining. And you are piping in from where?
From Chicago.
From Chicago. Fantastic. Yeah. Well, thank you so much for joining us. We're very excited to get to the advice you have for us a little bit later. So
thanks for having me.
Absolutely. So as with each show, we plan on covering the latest news on COVID-19 and how it relates to marketing communications. As we move through the show, please use the question queue in Zoom to answer any questions you'd like us to ask, and we'll get to as many as possible at the end of the show. We also keep track and try to answer the ones we couldn't get to the day before. You can also use the chat function, which is available in Zoom, to talk to other attendees. But if you'd like us to answer a question, make sure that goes into the question queue. And as a reminder, we're going to be posting a recording of every episode of the Daily Briefing Live. We'll do that by the end of the day, so sometime this afternoon. You can always visit our website at thinkrevivehealth.com. Banner at the top will lead you to the latest content we have, and we'll be making that a little more easy to use very shortly. Is that correct, Chase?
That's correct. We'll have it up we'll have it up this weekend.
All right, perfect. A couple of caveats and notes. We are not experts on COVID-19 from a medical or scientific standpoint, so always keep that in mind. We do have opinions and recommendations on how marketers and communicators in healthcare might want to manage the COVID-19 crisis, but you always have to take that in context with your specific situation. Obviously, this is hitting all of us in very different ways, depending on where you're from, what market you belong to or serve. So just always keep that in mind. So let's get going. First of all, we always want to start with a count because we think it's important to have that overall context as we think about communications from a hospital and health system standpoint. Today, as we look at the latest refresh of Johns Hopkins, which is the source we use, there are a lot of great sources. Right now, globally, we have 255,305 cases confirmed. In the United States, we have 14,322 cases. Just for a little perspective, when we started this daily podcast, which was just 2 days ago, that United States count was at 7,300. So we've essentially doubled in 2 days, which is not a exponential trend we'd like to see continue. Though we have all heard that we expect to see many, many more cases as testing becomes more widespread. So we also are up in the United States to 210 deaths, which is quite a bit more than we were at even a couple of days ago. So unfortunately, it's going the wrong way, but not a surprise probably to most people, and we'll continue to keep an eye on that. One correction, if you joined us yesterday for our podcast, during the podcast, someone had asked a question about an announcement that President Trump had made right at that time that the FDA had approved an anti-malarial drug to treat COVID-19. Turns out that wasn't entirely an accurate statement. So just want to clarify that. Unfortunately, that still may leave many of you in the hospital and health system space dealing with calls and questions about that kind of information, along with so much other misinformation that's out there. It's just something that you have to be ready to deal with from folks that are looking for help, and they will be turning to you as much as they turn to anybody else in our community. So just want to make a correction there. And then the last bit of news, I'm sure everybody knows about the news out of California, and then this morning, New York. We had a shift to level 4 travel alert for global travel. But trying to find a silver lining in all of this, the federal government announced today that the deadline for filing federal taxes has been moved to July 15th. So there's some good news for everybody. Get a little more time to do our taxes. All right. So resources, we wanted to mention again that we ran a national survey a couple days ago. We are almost finished pulling that together. That should be ready tomorrow. We will have it available on our website. We will be sending out to people on our list. So we'll make sure it's very easy to access for everybody. Again, we heard from 700 folks across the country. And just a couple of tidbits to pull out of that, just to share with you. 21% of respondents said they would check social media on an hourly basis for information on the crisis. At first, that number seems a little low. Again, I think all of us probably on this call probably check it on an hourly basis. That number is probably 90% of us in this space. But for the average person out there, that's still a pretty high number. And then 29% said they would check information coming directly from a hospital or other provider on a daily basis. So that's almost a third of the people that would be willing or looking for information coming from you folks at least once a day. So again, it just shows what folks are craving. They want information, they want accurate information. They're looking for guidance or looking for support. And as we heard from our survey results yesterday, hospitals and health systems are at the top of the resources they trust. So just really important for us to be playing that role out there. So we're going to move on and try to spend the most of the time today with Sylvia. We really want to hear from her around multicultural communications and marketing. And Sylvia, I'm just going to start. I'm not sure this is fair or accurate, but I'm going to start with my kind of perspective quickly. I can say that in all of the content that I've seen, the emails that have come in, going on websites, I have seen very, very little about this issue, about the need to understand different cultural communities, how to communicate to them, how they deal with the health system, how they would deal with this crisis. I'm actually very surprised at how little I'm seeing. So from your standpoint, what's your take on that? What are you seeing? And we'll just start with this question. How is approaching multicultural communications different during a crisis like this than from everyday communication?
Yeah, you're absolutely right. We have not seen a lot of information, especially, and I'm going to speak to mostly Hispanic consumers and Hispanic people, because that's my area of expertise. But I think you'll find that this is probably across the board in terms of reaching out to cultural communities. Mm-hmm. I would say that you probably don't have a lot of in-language information when we're not in a crisis. So now that we are in this crisis mode, and when the ramifications of lack of information are so immediate, it's really important for us to call out the fact that, there is a lack of information out there. I think, thankfully there have been some movements in terms of getting, calling it out. I think Associated Press this week and ABC News this week reported that, for example, if you go to the CDC page, there's not on the CDC Spanish page, there's not a lot of information. I think the last COVID update was February 20th. And that was the case when I went on the CDC Spanish website, last night. So it hasn't been updated. You mentioned the level 4 State Department travel advisory. Right. That hasn't been updated, which is, a big deal for a lot of, Hispanic travelers that have gone to see families that are maybe in Latin America right now. It still reports the level 3 and just to China, Iran, South Korea, and Italy, which we know was the case last week. Right. So when things are moving so quickly, and we know that that the information is not getting out there. It just, we know that locally, governments too, I think there was an article that talked about how, Arizona, that has a huge Hispanic population, has not updated their health information websites about COVID-19. So, this means that, at least for us, when you think of the healthcare systems that are already taxed with actually right. responding to COVID-19, they're going to have to bridge the gap in terms of getting people the right information. I actually, right before this call, went on a Facebook page for a healthcare system, and the English one is updated, has many pieces of content about COVID-19, about prevention, statistics, that kind of thing. You go on their Spanish page, and there's one video about hand washing, and it's not even on their main feed, it's in their video section.
Yeah.
So huge contrast. And, Hispanic newsrooms, just from a media perspective, have limited resources, and they are not going to be able to keep up with getting that information if somebody's not stepping up to create the content in Spanish and get that information in language.
Yeah, it's just, obviously connecting with multicultural audiences is always critical from a healthcare standpoint. But in this situation where it is so important that the general populace has the right information, everybody knows what to do, because what you do as an individual impacts all of those around you. So the idea that we are really leaving behind some of very large populations, across the country, and in some markets, dominant populations, is actually kind of a scary prospect.
Yeah, absolutely. I mean, you think about Miami, 70% of Miami residents are Hispanic. And obviously, we're not saying that every person in Miami that's Hispanic is Spanish dominant. But even if you think that half of them are, that's still 1 in 3 citizens of Miami that are not getting the right information.
Yeah, yeah. So speak a little bit to the cultural differences that you're aware of, in terms of how people might perceive or react to the COVID-19 crisis.
Well, there's things that we talk about when we talk about Hispanics and the way they think about healthcare. Even in the way that they get their information, the majority of Hispanics report getting the majority of their health information from their doctors and from healthcare organizations. And the second one is really close. It's television. But then when you look at the numbers a little bit more, this is in contrast, with Hispanics who, when you think about who gets regular health care, the majority of Hispanics are not getting regular health care. So they're not going to be getting that information, even though they say that they're getting their information from doctors. Television is going to be probably a big source, especially right now when many people are afraid to go to the doctor or are, being told not to go to the doctor with symptoms. And there's also, I think, beyond insurance or health, one of the things, I'm sorry, I'm getting a little ahead of myself, but
that's all right.
Among the Hispanic community, lack of insurance and underinsurance is a factor, right, to getting healthcare. But that's not the only thing. Cultural factors, there's still a huge reliance on home remedies. I think at the beginning of the crisis, I started to see a lot of memes pop up about, Vicks Vapor Rub and propolis being sort of the armament that Hispanics were going to use against COVID-19. I saw an Asian American meme that was, and it's in a funny tone. There was an Asian American meme about a mom boiling vinegar to fight against COVID-19. And it's funny and it's meant to, make people connect on that level, on that cultural level, but there is truth to every joke. And so, I think there was a census survey or information that came out a few years ago that said that 72% of Hispanics report never having used prescription drugs.
Wow.
So that when you compare to 66% of the general American population on prescription drugs, you see that there's a huge disconnect. Minimization of seriousness of disease is also a problem. We do a lot of diabetes work. And in the general market, you say, well, I have diabetes, I am diabetic. In Spanish, and I think even in African-American culture, you talk about having a little bit of sugar. I have a little bit of sugar. And, it minimizes the seriousness of a disease like diabetes. I think for Hispanics, this is particularly for Hispanics, they tend to be fatalistic. I know this from my own parents who are very much, well, if it's going to get me, it's going to get me. And there's not much I can do. And when you have a disease like heart disease or diabetes, maybe you can be a little fatalistic and still manage your disease. With COVID-19, we have, there's another level of vigilance that can only come from getting that information about how your actions really are the only thing that can protect you.
Yeah, yeah. So I'm gonna build on something that you said. I think everybody that I've talked to in our agency has a story about their parents. Um, and it is kind of crazy. This is, I don't know, in some ways multicultural, I guess. So there's kind of a different culture is the way to think about it. The story I'll tell really quickly was last night. We were talking to them. My parents are in their 80s. They have terminal illness, or not. One of them has terminal cancer, though she's doing fine. But they both have, a lot of stuff going on health-wise. And we told them, don't go to the grocery store. Don't go out. We'll do your grocery shopping. Called them last night. My dad's like, went to the grocery store, so you guys don't have to go. I'm like, what are you doing? And then this is kind of funny. I probably shouldn't out my parents this way, but after we got done, they forgot to hang up the phone, as they do sometimes. And so we heard their conversation, and they thought they were just so clever that they were, kind of poo-pooing us and protecting us. And aren't they sweet for worrying about us? But my dad literally said, well, based on what they said, tomorrow I'll get up at 7 to go because I'll be able to get more. So completely did not listen to anything we were saying. What I will give people is there's an article, we'll provide this in the show notes, on Slate that just came out, and I sent it to my wife. It says a psychologist explains how to get elderly people to take this seriously. And it's a great article. So we'll provide it in the show notes. I didn't mean to take us kind of astray, but it just reminded me, Sylvia, when you said that boy, that's a tough nut to crack too.
Yeah. And, and at least they have the information, they know, imagine not having the information, and, obviously defying the information is one thing, but not having it is a whole other ball game. So, yeah, it's super critical to get that information. I think, we've seen some good examples. I just saw a satellite media tour that AARP did that was directed toward Hispanic caregivers, which we know that there's a lot of, not only, Hispanic caregivers as a workforce, but also, Hispanic households tend to be multi-generational. So there's a lot of people who are taking care of grandparents or parents. And so they were specifically talking about the impact of COVID on caregivers and what can be done. So there are some organizations that are taking up the task of getting that information. But, when you see things like the CDC and, the real sources of information not stepping up to provide that in language information, it's pretty scary.
So we've got a couple questions already. And again, I would encourage people, if you have questions for Sylvia, please put them in the queue. And I want to make sure we have time to get to those. But before we do, any last advice you'd give for hospitals and health systems to ensure that they are approaching multicultural communications in the right way?
Yeah, I think number one, do it. So like I said, it's alarming. And so, like we talked about, minority markets like LA, Miami, having so many Hispanic residents, Spanish dominant residents, we just need everybody. It's sort of all hands on deck. So if you're not doing it, and it's so easy. There's, if you do a piece of content for your English page, if you do a mini infographic, it's not that much more time to get it translated and slap it on your Spanish page. That is like the, sort of really small thing that can be done to immediately start pumping more information to the people who need it.
Right. Okay. Anything else before we get to questions?
Yeah, I think from a messaging standpoint, tapping into family. We talked about, how Hispanics can be a little fatalistic and, but when we think about, for example, a Hispanic mom who puts her family first, often she puts her kids' needs, her husband's needs, her parents' needs before hers. But if you can give her that message that her taking care of her, because this is so proliferative, right? Because this is so, contagious, and it's based, you can mitigate it by your own actions. I think tapping into that family duty to take care of everybody can really help to get that message across.
Yeah, and we had talked earlier, you had a point to make about Hispanics and mobile as well.
Yes, Hispanics are mobile first. 99% of Hispanics have, wireless phone service. They actually outpace the general market with mobile phone ownership by 9%. So if we could push information via apps, via texting programs, I mean, that is a really fast way to get the right information in the right hands quickly.
Yeah, and it's probably worth reminding folks that this kind of advice is, boy, like 5 years old. But we should no longer be, of course, thinking of mobile as inferring that you're out moving around, right? So we don't want anybody going, well, nobody's mobile now because they're all quarantined and staying at home. People consume most of their content on mobile devices when they're sitting on their couch. So it's not about people being out and about, right? It's about the devices they use. Mm-hmm. So good time to remember that. All right. So let's get to a couple questions. There's one off the bat that I want to take, Sylvia, that's not necessarily multicultural, but I think it's really important. And the question is, do you think health systems, hospitals, physicians should push out their local PSAs for their community, or should they rely on the government agencies to handle that? We actually are getting that question a lot from clients and others. Our point of view anyway is 100% yes. We talked yesterday about the survey we did. Trust hospitals and health systems more than any other resource, the media, national health experts, the government. So your most trusted folks are going to be interacting with you when push comes to shove, when they are faced with, do I get a test? Do I have COVID? How am I getting treatment? There is an absolute void to be filled right now in our society in terms of leadership, and hospitals and health systems can step into that, and not just for their own benefit, but to help their communities. Our communities really need this information. They need support. They need encouragement. And 100%, we think hospitals and health systems should do that. Of course, it should be aligned with what, if it's accurate, we're hearing from other resources, of course. Anything you put out should be accurate. But to Sylvia's point earlier, don't just rely on the CDC. The CDC is behind in many ways. So make sure you have the best information that you put out there. But if we're just relying on the CDC, they can't keep their website updated, I think we're going to be behind in this. So I just want to get that one out of the way. Here's another question for you, Sylvia. This one's for you. You've talked obviously a lot about Hispanic audiences. How much of what you're talking about would you say, kind of holds true for other cultures? Like here in Minneapolis, we have a very strong Russian culture. We have, I think, the largest Somali culture in the country. A lot of Hmong here in Minneapolis. Obviously, whatever market you're in may vary. So how much of what you're talking about holds up for other cultures?
Yeah, I mean, I think the messaging might be a little bit different, but I think just getting that information in language is really important, just because we know that, our health in terms of staying healthy from COVID-19 depends on what our neighbors do, depends on, what our family members do. And so it's just important to make sure that we're covering all our bases when it comes to getting the right information in language to the cultures that the health systems in each city serves.
Yeah. Okay, here's another one. This is great because if this question hadn't come up, I probably would have asked you it anyway. The question is from an anonymous attendee, and they say, if you're not staffed to deliver on multicultural communications, how do you recommend delivering on this? And then it says asking for a friend. And whenever I see asking for a friend, it's usually like a joke. People are like, oh, it's not me who needs this help, it's somebody else. I think a lot of hospitals and health systems need the answer to this question, because rural hospitals, smaller hospitals, even hospitals though that are well staffed, but might be in Manhattan or might be in San Francisco or Seattle, where their resources are great because of what they're dealing with at the moment. What's your advice for folks that just don't have, as they look around, the resources to do this in the way that we should be doing it?
I mean, I think there's such simple ways of doing it. I mean, obviously translation isn't necessarily something that's difficult to do now with the advent of, having the ability to work online with people and remotely and that kind of thing as we see now. And I think most health systems will be able to find some kind of spokesperson, a doctor, a physician that can speak to that community. I think the ARP SMT was a great example of how quickly they got a spokesperson to talk about something, a very a specific subject, right? But I think, just thinking about my clients, we work most of the year to find those subject experts that can deliver messages in Spanish on a myriad of topics. And so I think if you can find one physician, one administrator who can speak in language, then I think you can just start there and think of ways that you can start pumping out information, whether it's linking up with the media. I think Univision and Telemundo, the major networks, have their public affairs team that can work with health systems to create PSAs. I mean, sometimes it's very turnkey where, the healthcare system goes to Univision and Telemundo, they create the content and pump it out with the information that the healthcare system gives them. So there's so many turnkey ways to do it now, but it's just a matter of making the effort to, number one, identify the fact that you need to do it, and number two, putting the resources towards doing it.
Whatever resources you can. Right?
Whatever resources you can, exactly.
Right. Okay, so one last question. This is a really good one, and we may need to give this even some more thought and get back with a fuller answer. But I'm gonna ask it and do your best here, Sylvia. I am working with language access services in a children's hospital that just implemented video remote interpretation. How can a hospital with a developing or early stage language access plan make sure to comprehensively address COVID-19 education in English learner populations?
I think the number one thing is having the right information translated correctly. That obviously we can't look to the CDC, right now at this moment. Maybe they're working toward getting that information, but like I mentioned, the last update was February 20th. And when I mentioned February 20th earlier, I didn't realize that was a whole month ago.
Right. It feels like a year ago. Time has lost all meaning in
Absolutely.
this crisis.
I thought it was March 5th. Yeah. It's March 20th. So when you think about that lag of a month, we have to find ways to get that information in language, and then, like I said, just start getting it out there. I think if they're doing consultations with patients, whether it doesn't matter what it's about, COVID-19 has to be a part of that conversation.
Yeah. Okay. So I think we're going to wrap there. Again, as we've said, please let us know if there's something you'd like us to cover. You can always email me directly at cab@thinkrevivehealth.com. You can put something in the queue right now or in the channel. When we post the recording of this later, there's a resource there that you can provide feedback. So just want to make sure that we are covering what people feel like they need to have covered. This is a fast-moving situation. And so, even things that we've covered before, we're going to revisit because dynamics change and how we approach any of these things will change. So, Sylvia, I really want to thank you for joining us. Really appreciate you being here. Such an important dynamic for people to think about.
Thank you for inviting me. I hope the information was helpful to everybody.
Yeah, absolutely. And Chase, as always, sir, thank you.
Absolutely.
We will be back on Monday. So we're again honored that we're going to have a great guest, Alan Shoebridge from Salinas Valley Medical Center in California. He's going to join us. Many of you know Alan because he has a really thoughtful voice for our industry. And so I'm very anxious to hear his take on some of this and also where he's based and some of the things they're dealing with in California. Obviously, Monday's a long way away from today. So hopefully everybody has a good weekend in between now and then. Remember to visit thinkrevivehealth.com for a recording of today's episode. That should be up later today. Share this link in our video cast with anybody you think is going to need it. And again, as we keep saying every time, hang in there. Keep doing the amazing work that you're doing. Communications is so critical for all of us to get through this crisis. Multicultural communication, any communication, just so important in supporting the hard work that your organizations are doing, your doctors, your nurses, everybody who's on the front line. But if we can't communicate the right way, it's just going to make things worse, not better. So thank you for everything you guys are doing. Keep it up. We'll be back on Monday and every day until this crisis passes. So have a good weekend as best you can, and we'll talk to you Monday.